The most commonest type of heart disease seen in children with Down syndrome is ostium primum type of ASD, while the most specific heart disease encountered in children with Down syndrome is complete endocardial cushion defect. Welcome back to my channel. In today's video, we are going to discuss one-liner as well as many MCQs in reference to topic Down syndromes, which are all high yield. Do not skip anything, watch till end. Hi, my name is Dr. Triya Malde, pediatrician and consultant neonatologist. I'll be your guide for pediatric subject. If you are new to my channel, please do subscribe and give like to this video because lot is going to happen for pediatrics on this channel. So let's start with the questions. Which syndrome is likely to be caused by chromosomal abnormality shown in the karyotype provided? Options are Down syndrome, Klinefelter syndrome, Turner syndrome, or it is Sotos syndrome. So we are going to observe the karyotype carefully. The obvious abnormalities which is seen here is at 21 number there are 3 chromosomes. So it is trisomy 21 and the correct answer is Down syndrome. So what is Down syndrome? It is the most common type of chromosomal disorders. Trisomy 21, it is seen in 1 into 800 or 1200 live births, and it is one extra chromosome either from mother or father. So next question is, in Down syndrome there is, options are translocation, mutation, paternal non-disjunction, or it is a maternal non-disjunction. The correct answer is option D, maternal non-disjunction. We are going to discuss it in detail in upcoming slides. So what are the cytogenetics of Down syndrome? We all know that it is a trisomy 21. 95% of the patients or children, it is due to non-disjunction in maternal meiosis. 1% is mosaic, in which the few of the cell line will have a normal chromosomes and few of the cell line will have a trisomy 21. Rest, it could be translocation at 21 and 14, or it could be a balanced translocation 21 and 21. So this is a normal meiosis in which there is a normal cell divisions, while in case this is a maternal egg, and while doing a meiosis stage 1, what is happening, in place of 23 there will be a 22 in one cell and 24 in another, and this 24 when get fertilized by sperm, it will result in 47 with one extra chromosome at 21. There could be a translocation, like the extra copy of 21 chromosomes could be attached to site 14 or 21. This could also result in trisomy 21. This could also result in Down syndrome. So in Down syndrome, all are seen except T1421, trisomy 21, 1114, or translocation 1521. We all know that it is a trisomy 21. So one extra chromosome of number 21 is doing all kind of problems. So yes, it could be T1421. Yes, this is correct. It could be trisomy 21. Here it is not possible because we require a 21 chromosome, which is causing all kind of problems in Down syndrome. So this could not be possible. This could be possible, that this 15 and 21. So correct answer is option C, T11 by 14. The next question is, Down syndrome most commonly occurs due to reciprocal translocation, non-disjunction in maternal meiosis, translocation defect, or non-disjunction in paternal meiosis. Here we need to see the most commonly due to. So we have observed that it is 95% due to maternal non-disjunction in meiosis stage 1. So correct answer will be option B, non-disjunction in maternal meiosis. Next question is, most common chromosomal syndrome is, this also we have discussed that most common chromosomal syndrome is trisomy 21. Next question is, a 35 years old lady has chromosomal translocation 21 by 21. The risk of Down syndrome in child is 100%, 0%, 10%, or 50%. This is exam question. Please do remember, whenever it is a 21 by 21, it is called Robertsonian translocation, and whenever we have this kind of chromosomal study in parents, it means there is 100% of chance that the baby will be having Down syndrome. So here the risk of Down syndrome in upcoming generation is 100%. Next question is, prenatal diagnosis of Down syndrome is by karyotyping, triple test, fetal USG, or all of the above? The correct answer is it is all of the above. The diagnosis could be done by all three of them. We are going to discuss in detail in the next slides. So prenatal diagnosis, the first screening test could be a triple test. In triple test, we are taking a maternal sample for alpha fetoprotein, beta HCG, and estriol. So we have to remember HI. HI is formed by letter H and I. So there will be high level of HCG and inhibin. Then it will be positive test for the Down syndrome. Here it is a triple test only. So HCG will be on the higher level while alpha fetoprotein and estriol will be on the lower side. But this is the mnemonic we need to remember for all kind of prenatal screening. HI, high is high HCG as well as high inhibin. If you see the quad test, it will be in inclusion of the inhibin, in which there will be an increased level of inhibin, there will be high level of HCG, while alpha fetoprotein and estriol will be on the lower side. So what are the other conditions in which we could be having a fetus with high HCG? It could be a part of multiple pregnancy, could be a part of Rh isoimmunization, obviously Down syndrome, could be a choriocarcinoma, or it could be hydatiform. Next question, knuckle thickness more than of this millimeter at 11 to 14 weeks of pregnancy is suggestive of Down syndrome. So option are 2, 3, 4 and 5. It is more than 2.5 mm, but here the most relevant and closer answer is number 3. So we are going to write 3. Then we are going to discuss prenatal diagnosis, first trimester screening. We need to remember whole family, in which we will remember beta, that is beta, papa, mom and aunt. So beta stands for beta HCG, papa stands for pregnancy arrived plasma protein A, mom is multiply of median because these all values will be in the multiply of the medium. Stands for two things, multiply of medium as well as MA, that is maternal age, and aunt stand for antenatal USG for knuckle translucency. So we need to remember that beta, papa is carrying the beta on the shoulder, so beta on the higher side, beta is on the higher side while papa is on the lower side. So when the beta is high, papa is low, in the multiply of the medium, most probably 2.5 mom, more than 2.5 mom, and if there is a positive antenatal USG for knuckle translucenation more than 2.5, it means this screening test is positive for Down syndrome, and this lady has to be subjected for prenatal diagnosis for the confirmation. So here also papa, mom and beta, it means pregnancy arrived plasma protein A, mom is for multiply of medium as well as maternal age, and the beta, then there will be a 70% detection rate for the Down syndrome. Mom plus aunt, that maternal age as well as knuckle translucency, then it is 80% of the detection rate. But when we combine all of that, papa, mom, that is mom as well as maternal age, beta HCG and the aunt, then 87% of the detection rate for the Down syndrome. So recent marker for Down syndrome is, options are HCG, alpha fetoprotein, inhibin, or it is estriol. The correct answer is option C, inhibin. The next question is, for prenatal diagnosis of Down syndrome, all are true except reduced femur and humerus length, knuckle 4 thickness of more than 2.5 mm, increased umbilical flow, and VSD may be present. See, all of these are a soft marker for the Down syndrome except this one. So reduced femur and humerus length, yes. This is also yes. Increased umbilical flow is not seen along with the Down syndrome. Yes, it could be a VSD because AST and VSD could be the commonest type of heart disease which is seen in a children suffering from Down syndrome. So option C is incorrect, rest all are correct. The next question is, all of the following are features of Down syndrome except increased papa, increased free beta HCG, absent nasal bone, or it is absent ductus venosus flow. That beta is above the papa. So beta is on the higher side, papa is on the lower side. So this is incorrect because decreased PAPPA is seen in a prenatal diagnostic test when we are having a baby with Down syndrome. So increased papa is not a correct. Abnormal ductus venous flow could be a part of congenital heart disease. So it could be seen, absent nasal bone also could be seen, but this is not a part of Down syndrome. So this is just a repetition of the previous slide, that in a pre-diagnostic test, HCG is on the higher side, inhibin is on the higher side, while papa is on the lower side. The triple test for the diagnosis of Down syndrome includes all of the following except beta HCG, alpha fetoprotein, serum HPL level or serum estriol level. We all know that it could not be a HPL level because we have not discussed it. It is HCG, alpha fetoprotein and estriol is a part of a triple test. Increased knuckle fold thickness is a feature of Paul Bunel syndrome, Depan syndrome, Down syndrome or Cri-du-Chat syndrome. It is a part of Down syndrome. We all know that thing because we have just now discussed that knuckle translucency and knuckle fold thickness is a feature of Down syndrome. The next question is, among the following, the most sensitive USG finding of trisomy 21 is the most sensitive. Please take a note of this word, the most sensitive. Absent nasal bone, thickened knuckle fold, short femur and echogenic bowels. Rest all are soft markers of Down syndrome, which are called soft markers. It could not point towards the most sensitive markers. The most sensitive marker is thickened knuckle folds between the USG of 11 to 14 weeks. The next question is, all of the following are biochemical markers in second trimester screening of Down syndrome. Here it is a second trimester screening. Papa, beta HCG, inhibin or it is unconjugated estriol. Because papa is done in the first trimester of the pregnancy, so it is not a second trimester screening. These all are second trimester screening. Most common CVS lesion in syndrome. This also we have discussed that most specific type of CVS is endocardial defect, cushion defect, and if you don't have ASD in the option, then most commonest type of congenital heart disease also endocardial cushion defect. Look at the facial features of the child carefully. Most likely diagnosis is Down syndrome, Patau syndrome, Cri-du-Chat syndrome or Edwards syndrome. By looking at the face, we can make out many things, that there is a mongoloid slant, there is epicanthal float, there is macroglossia, as well as the facial features which is matching towards the Down syndrome. So correct answer is Down syndrome. So we are going to discuss quickly all the clinical feature of the Down syndrome. Very nice mnemonic to remember all of them is a do, I, checkup, alongside. So we have to remember D, E, C in alongside A, as well as O stands for O and S stands for side. And there is a 3 of each. So for D we'll have a 3 features, for E 3 features. Still S we are going to have a 3 feature for each word. So this is a mnemonic you have to remember, do, I, checkup, alongside. D stands for depressed nasal bridge. You can see here the nasal bridge is depressed. Decreased IQ, that is intellectual disability. Down ear means there will be a low set ears. Low set ear is whenever the line is drawn from the inner canthus of the eye, the ear should stay above the line, but here it is below the line, so it is called low set ear or down ear. Down ears. E stands for epicanthal fold. In iris there will be a brushfield spots and eye mongoloid slants. You can make out this is a mongoloid slant. Mongoloid slants is like this. The eye shape will be like this. This is mongoloid slant. And then what is epicanthal fold? Epicanthal fold is a skin fold of the upper eyelid which is covering the inner corner of the eye. The upper eyelid, the fold coming from the upper eyelid is covering the inner corner of the eye, then it is called epicanthal fold. For C we need to remember, C stands for CHD, congenital hypothyroidism and clinodactyly. What is clinodactyly? Incurvature of the little finger, which is shown in the picture, is called a clinodactyly. CHD, we are going to discuss that most specific CHD is a complete endocardial cushion defect, as it is shown in this. The wall separating all four chambers of the heart are poorly formed or absent. All walls like ventricular septum as well as atrium septum is absent here, and there is also could be a defect in the valve of the heart. So this is called a complete endocardial cushion defect. Another most common type of heart disease, which is the most common type of heart disease which is seen in a patient of Down syndrome is ostium primum type of ASD. Usually it is ostium secundum. There is a presence of foramen oval as well as septum secundum. If there is a defect in the septum secundum, it is called a ostium secundum type of ASD. All of the ASD are of this type, while if there is a defect in the ostium primum, which is shown in this figure, it is called OP-ASD, which is the ASD seen in a child with Down syndrome. So we have discussed D, E and C. Now we are discussing A. A stands for again 3, atlantoaxial dislocation. The second A stands for AML, acute promyeloblastic leukemia M7. This is very important exam question, that which type of leukemia is seen in a patient of Down syndrome. And another last A stands for Alzheimer's. This is also exam question, that the patients of Down syndrome or children of Down syndromes are prone to have a Alzheimer's disease. What is atlantoaxial dislocation? It means there will be a misalignment of first and second cervical vertebrae. So we have discussed D, E, C as well as A. Now we are discussing O. Do eye checkup alongside. O stands for flat occiput. The patient of Down syndrome will have a flat occiput. They'll have an open and wide fontanelle, and they will be having a round face. Now the last S is a single palmar crease, which is called a Simian crease, which is shown here in this figure. There is a present of sandal gap that is also shown here in the figure, and there will be a short stubby fingers. So next question is, palm of the child with 21 trisomy shown, what is this sign known as? This is very simple question. If you see the one line running, single line running from in the center of the palm, it is called Simian crease. What are the conditions in which we can have a Simian case? It could be a part of Down syndrome, fetal alcohol syndrome, trisomy 13, that is Patau syndrome, congenital rubella syndrome, Turner syndrome, Klinefelter syndrome as well as Cre-Du-Chat syndrome. These are two normal palm creases seen in a normal persons. This is a single line seen in a patient of Down syndrome and another other syndromes, and these are Sydney lines. If this line is also elongated till the ulnar end, this is called Sydney line. Simian crease is seen in all except Down syndrome, trisomy 13, Turner syndrome or Noonan syndrome. Just now we have discussed this. It could be seen in these three, but it cannot be seen in Noonan syndrome. So option C, option D is a correct Noonan syndrome. The next question is, most common presentation of Down syndrome is cognitive impairment, delayed dentition, recurrent chest infection or constipation. All of these are presentation of Down syndrome, but the most commonest presentation to the OPD is cognitive impairment. Most of the time parents bring child to the pediatrician or a clinician that they feel that child intelligence is below normal. 13 pairs of ribs can be seen in all of the following except Down syndrome, Holt-Oram syndrome, Turner syndrome or incontinentia pigmenti. The correct answer is rest all will have a 13 pair. Down syndrome will not have a 13 pairs of the ribs. Here it could be only 12 pairs of rib, but here it is 13 pairs. All of the following is a feature of Down syndrome except brushfield folds, brushfield spots, Simian crease, mental retardation or hypotonia. This all could be a part of Down syndrome, but patient of Down syndrome will not have a hypertonia, they will have hypotonia. So option D is incorrect. The next question is, transient myeloproliferative disorders occurs with increased incidence in children with Down syndrome, Turner syndrome, ataxia telangiectasia or NF. It is seen with the patient of Down syndrome, as the AML M7 is also commonly seen in patient with Down syndrome. Transient myeloproliferative disorders also seen in a patients of Down syndrome. A Down syndrome patient is posted for surgery. The necessary preoperative investigation to be done with, ideally speaking, all the investigation has to be done, but if we have to pick up only one, then the most important investigation to rule out congenital heart disease is echocardiography. So the necessary investigation is a echocardiography. True about Down syndrome are all except mental retardation, hypotonia, coarctation of aorta or epicanthal fold. We have seen that this is a common presentation. Hypotonia is also seen, while COA is not a part of Down syndrome, it is a part of Turner syndrome, and epicanthal fold is also seen in a patient of Down syndrome. So correct answer is coarctation of the aorta. The next question is, commonest cause of intestinal obstruction in Down syndrome is colonic atresia, intestinal atresia, duodenal atresia, or it is esophageal atresia. The correct answer is, the commonest intestinal problem patient of Down syndrome is duodenal atresia, and it can lead to intestinal obstruction. So correct answer is duodenal atresia. I hope you all understood and learnt well. Your suggestions are always welcome for the improvement of my channel and topic. Please let me know what else you would like to learn from me. Till that time, take care of yourself, study hard as well as study smart. Bye.